The COVID-19 pandemic laid bare the racial inequities that plague American healthcare, with Black people dying of the disease at a rate more than double that of white people. Author Linda Villarosa has been writing about the racial disparities in health outcomes for decades and recently covered the topic for the New York Times 1619 Project. She says that while she used to think poverty was to blame for Black Americans' health problems, she's now convinced that bias in the healthcare system and the weathering effects of living in a racist society are taking a serious toll on African Americans. Villarosa points to weathering, a concept developed by public health professor Dr. Arilan Geronimus, as a wear on the body that results from prolonged exposure to stress. Your heart rate goes up, your cortisol stress levels go up in your body. Your blood pressure rises, she says. It's not good for the body. But when people are treated badly, that's what happens. In her book, Under the Skin, Villarosa argues that any effort to close the gap in health outcomes must also address the structural racism that underpins the U.S. healthcare system. She points to historical myths about Black bodies, including the fallacy that Black people have a higher pain tolerance than white people, that continue to impact the way care is delivered. In 2019, for instance, researchers from UNC Chapel Hill published a study that showed that Black women did not receive as much pain management following a C-section as white women, even when everything else was the same. Perhaps, Villarosa says, because of implicit biases among medical students and so that means that we need to do things differently here, she says. Villarosa says that while she used to tiptoe around the word racism when she spoke on panels, she no longer feels like the need to avoid the term. We're not accusing individuals of being racist, but we're saying there is something wrong with what is happening in America, she says. When you identify the problem, when you discuss the problem, it's easier to address the problem and come up with solutions than it is when you're pretending like it doesn't exist. The following interview has been edited for length and clarity. On writing about the health crisis in Black America for Essence in the 80s, and assuming problems were our own fault, it was clear that there were racial health disparities. Black Americans had higher rates in so-called lifestyle diseases, is what we called them then, and it was heart disease, diabetes, stroke, asthma. We knew that, but we just didn't understand the cause. And so the explanation was it's our own fault.